Welcome, everyone. My name is Adam Savitt. I am Director of Communications at the Center for Security Policy, and I'm proud to welcome you to the second webinar in our series on biothreats, supporting the launch of our new book, Defending Against Biothreats, What We Can Learn from the Coronavirus Pandemic to Enhance U.S. Defenses Against Pandemics and Biological Weapons. This is the second of 5 webinars featuring the authors of this work, continuing through the end of next week, so be sure to register on our website, securefreedom.org. Today's panel is entitled Developing Reliable Biodefenses in an Uncertain World, featuring Dr. Kenneth Alibek and Alibek and Tskhay, and moderated by Center President Fred Fleitz. Please note that you are in listen-only mode, but you can ask questions on the Q&A panel on the GoToWebinar control panel. And this event is being recorded and will be available on our YouTube channel, youtube.com/securefreedom, as well as on our website, securefreedom.org. With that, I'll pass it over to my colleague, Fred Fleitz.
Hey, Adam, thank you. And I'd like to thank you all for joining this important webinar today. The Center put together this book, Defending Against Biothreats, both to talk about the current crisis we have with the novel coronavirus pandemic, but also to look at the long-term implications, to look at U.S. biodefenses, to look at what America's enemies learned from this pandemic, what lessons it may have learned to stage attacks against our country. And we also believe that the American voter has to keep these things in mind when they go to the polls this November, that they should be voting for people who take this threat seriously and are not simply trying to use the virus for political reasons. We have 11 outstanding experts who contributed to this book, and 2 of them are leaders in the biological sciences, and they have joined me today. Ken Alibek is a former research director of the Soviet Union's biological weapons program. He is an expert in the field of biological weapons and biodefense. He is the author of more than 60 articles in American and international peer-reviewed journals. He has written and edited 6 monographs, including the best-selling book, Biohazard, the chilling true story of the largest covert biological weapons program in the world, told from inside by the man who ran it. Dr. Alibek, welcome.
Hello, everybody.
Alibek and Tskhay is the leader of the scientific and analytic group evaluating the effectiveness of treatment methods and developing new biomedical products at Locus Fermentation Solutions. She is one of the leading authors of 7 scientific articles written for peer-reviewed articles in the United States on infections, neurological, oncological, and other diseases. She also is the author of 22 patents and patent applications. Alibek, welcome.
Oh, thank you.
I would like to ask the 2 of you questions about the 2 outstanding chapters you wrote for this book, but I wanted to start out by giving you an opportunity to simply comment on the state of the novel coronavirus and what do we know about it right now?
If I may, maybe I'll tell you start with some history, I would say. We know that coronavirus actually is not something new to us. We know of a few coronaviruses which can cause some very light infections, and we would never consider them a big threat. But the first threat we got, it was 2003, 2004. It was the first coronavirus. Second came to us in 2012. It's called MERS coronavirus. And what is interesting, I mean, we had several discussions in 2004, 2005, and our common opinion was to come back. This is our strong opinion. Sometimes we are quite reactive, we're not proactive. There was some discussion about developing defense, nothing happened. In this case, I would say, this is actually a very good example of something which could be happening to us over and over again. Now, just in the beginning, when it started, we didn't think it would be a big problem. Now you see, because same coronavirus with a much higher level of contagiousness, having a relatively moderate number of deaths, but based on contagious number of people infected, we see many more deaths at this point in time. In this case, unfortunately, this pandemic doesn't behave the kind of usual way, as we usually expect. This epidemic will subside down in the summertime, will come back, for example, in winter time, or some meteorological conditions play a role. In this virus, nationally, this is taking place. There are many more things that could have been said, but in this case, I would ask Albina if you discuss some additional things.
I would say that this situation with coronavirus, with COVID, showed that we are unprepared to such a threat in terms of medical protection. And yes, we can say that currently many companies, many universities are working on vaccines, on treatment. But while we are waiting for clinical trials, while we are waiting for the results, we see that thousands of people are dying every day, and we cannot allow this happening. And in our book chapters, we focused on possible alternative ways of protecting population. And these ways included non-specific protection, which is based on our immune system's abilities to defend against viral and bacterial infections, and on the ways to stimulate immune system to give a higher level of protection. And probably later today we'll discuss these ways in more details. As well, in one of the chapters, we discussed that the condition of chronic inflammation, which is a major problem in the current healthcare system. Chronic inflammation creates a condition in the organisms that our immune systems are not able to provide sufficient protection against viral infections. And today's situation revealed how many people are actually unprotected, and any other infectious threat in the form of any other viral or bacterial infection would result in a similar situation, because people's immune system, condition of people's immune system was ignored for many years, and the problem of chronic inflammation, known from many thousands or many hundreds of articles, was kept ignored.
Well, in terms of defenses and treatments for the coronavirus, could you talk about where we are on antivirals and vaccines? Specifically, how optimistic are you that we will have an effective vaccine by the end of the year?
You know, it's a very interesting question. But again, you know, just unfortunately, sometimes we have a very short memory. Some people remember what happened to us in 2001. You remember this country's scare, and it was a big, let me say, a panic. Let me say, we started talking about how we develop defense, started developing vaccines, and so on and so forth. Okay, it's first. Second, something happened to us in 2004 in the form of SARS epidemic. Then we had bird flu, we had swine flu, and so on and so forth. And anytime when we see it as a threat, let me say, just we're always unprepared. Always. There was no single case when we say, okay, guys, we're ready, and we can start doing something. This is the biggest, in my opinion, problem. But the problem is even more, I would say, getting worse, because if we start analyzing step by step what has been discussed, what kind of discussions we had for over time, and if somebody remembers, there was work done by DARPA. We know what DARPA is, correct? And there was a great program. I mean, the name of the program was Protection from Unconventional Threat. It was a program specifically focused on protecting general population and troops against unknown threats, unknown infections. It was a great work done. I mean, and I have no idea why the program was terminated in 2006, 2007. And the general idea is, I mean, just, okay, we talk about vaccines. In our first chapter, we divided, let me say, types of defense. I mean, it's vaccination, it's one of the possible. But vaccination, I mean, just when we have some unknown virus, what kind of vaccination we can talk about, because there is no specific term. And with this vaccine, even we have more than 100 companies working on this vaccine. I mean, maybe we'll get something, but there are so many ifs. But there is another way of defense, and why we don't pay attention. Sometimes I'm getting, I wouldn't say angry, but just what I cannot understand, why people who are responsible for our medical defense in the country wouldn't pay attention to what has been done already. First defense designed against unknown viruses was done in 1983. Was done here in the United States. And over time, we had so many research publications. We had clinical trials. I'm talking about different institutions, different countries, United States, Canada, Australia, and so on and so forth. Saying, okay, guys, we have some defense. And defense, let me say, is so simple. I mean, it's based on the modulation of innate immunity. It was shown many, many times that we can reduce, risk of death. We can reduce the number of people who would either get infection or would die of infection. In this case, can you imagine 1983, now 2020. Then we had something done in 2006, just during under President Bush. But why, for example, this type of defense, which is clearly explained, showing perfect results with a lot of human trials. This has never been accepted, never been discussed. Ben and myself, we tried to publish a couple of articles, review articles, send into New England Journal of Medicine, sent to the Journal of Infectious Diseases. They rejected publishing these reviews because it was not our work. We were talking about possible defense 3 months ago, 2 months ago. And just sometimes I think, okay, there is a simple logic, let me say, in defense. Okay, you need to reduce, let me say, a viral load in the beginning. This is the way how, for example, defenses is developed. We've done this work because working for years in the field of biological weapons, we knew in case of some new infections, we would never be able to deploy a vaccine, for example, just to save as many as possible lives in the beginning of epidemic. This is the biggest thing. Okay, why we're always reactive, not proactive. In this case, you can imagine losing so many lives, hundreds of thousands of lives. And then just still have a situation in which we'll be seeing more and more deaths every single day in the United States and the world. Please take a look. This is what I'm saying. This is our medical officials. Take a look at two groups of countries. One group, let me say, are countries which are constantly using hydroxyquinolone and chloroquine, for example, just for malaria, and compare how many deaths they're having per million. Another group of countries, former Soviet Union countries, they developed this type of protection based on innate immunity activation in the 80s, and they deployed it. And there is a Ministry of Health recommendation which is clearly states, in order to protect against getting infected, please take this and this. This is the case. And why, for example, in the United States, our sophisticated country, with huge number of perfect scientists, why we would use anything like this? Even though, for example, there was a program, the program actually clearly stated there is defense. And just rely on vaccines, yes, maybe would have vaccine, but no. Can you imagine how many people would die before we have this vaccine?
Okay, I want to ask Albina to comment on where do you think we stand on vaccines, and then I have a very big question I want to follow up with both of you on.
Currently, there are several news from various universities and companies that they have the last stage of the development, and they need to finish last clinical trials to prove the efficacy and safety of these vaccines. However, we shouldn't forget about several peculiarities of this virus that may make these vaccines either ineffective or even dangerous. First peculiarity is antibody-dependent enhancement. And currently there are publications showing that we can expect this antibody-dependent enhancement with this coronavirus. What it means? It means that after having antibodies against this virus, if we get some mutated form of virus with a slightly different antigen, it would mean that infection with this virus will be even more severe. And we are not simply, we are not just unprotected, we're also in a greater risk of getting severe complications from this infection. And this outcome was shown for some other coronaviruses, for example, feline coronavirus. It was shown that when older cats are vaccinated against coronaviruses and then they're infected, the outcome is more severe and the rate of mortality is higher. And currently, all vaccines which are enter the safety trials, they're tested on young, healthy population, and are shown safe. But we can't expect the same result for if the same vaccines are tested on people with some diseases, chronic diseases, or for older people. Another problem is that it was already shown that antibodies to coronavirus are not circulated in our blood for too long. Some studies say that it's 3 months, some say that it's for 6 months. And it means that even if safe and effective vaccine will be invented, we cannot guarantee that it will protect a population for more than 3 months. And it will require governments to vaccinate population every 3 months, which is very expensive. And we know that currently many people are against vaccination. And so what level of protection we'll get with such vaccines, I don't know. The problem is...
No, I'm sorry, just a small addition, because this type of vaccines, if they are not live vaccines, they would require always some boosting shots. In this case, it's not just a primary vaccination, 2, 3 boosting shots would be required. Maybe in this case, they would induce some sufficient protection. But again, it's still a question what Albin is saying. It's a big thing because they are not long-living antibodies.
Yes,
Wow,
and
that's not good news. I want to move on to a controversial question that you gave a very good answer to in one of your chapters, and you wrote that the pattern of infection shows that this was not a biological weapons attack. It was a natural epidemic with a new coronavirus. And you also discuss how scientists like yourselves differentiate between man-made and natural epidemics. Now, you know there are many people who don't know what they're talking about, who are claiming that this was a biological weapon. So could you both comment on that?
Fair question, of course. If, for example, we decide to discuss it, it could be a very, very long explanation. So many different factors could be taken into consideration. And that's why Albin and myself, we discussed, the possibility of opening a special program, let me say, for future experts to train them, let me say, because it's the problem is not going to go away for years ahead. But just when we say about this, it's a pattern of infection. What deployment of biological weapons? The best way of deployment actually is aerosol deployment. In this case, you can imagine for each agent we have a certain time frame in terms of incubation period. When we start seeing first cases, in case of biological weapon attack, we would say it's a number of cases. Yes, a number could be big based on, let me say, on a number of, I would say, infected people appearing simultaneously. In this case, because all biological weapons, they designed in such a way that could be deployed by aerosol. And in this case, you can imagine a focus of infection would be quite large. A number of people infected simultaneously will be quite big, and it would be absolutely obvious if some event happened, for example, and especially as soon as you do some, I would say, investigation, I mean, epidemiological investigation, you can get information when it occurred, when these people were at some point of time, and so on and so forth. You know, just in case of a natural epidemic, especially something new, it's always possible just to find what the patient zero. Patient zero, it's the first, like in case of in case of coronavirus, I mean, we can track down, let me say, going backward, we can see when the first cases appear. And of course, we cannot say exactly at this point of time what was the date. But first patient, I mean, traced in China was actually the patient who got disease or admitted to a hospital on November 17th. In this case, we would see, for example, how, let me say, infection is progressing. How, for example, from a single case, we start seeing 4 or 5 cases, more and more and more. It's called sequential infection. In this case, this is the first most important difference. Nobody would deploy biological weapon infecting a single person, and it will be a biological weapon. And there are so many other things. For example, who to blame for this? Okay, China would attack itself. I mean, it's absolutely logical. I mean, this whole Russia would attack again. There is no sense. And even more, okay, some people would say, okay, it was biological attack. Some crazy people, I would say, done by the United States. And craziness of this is absolutely, I mean, difficult even just to understand these people, because how the country understanding that it was a contagious infection, with a very high level of transmissibility, very high level of contagion. It was absolutely obvious after it's deployed that you have no control of how infection would be developed. And in this case, it would mean okay, the United States or some country attack China, and finally it gets, let me say, the severity of infection, let me say, in the own country, which it actually is destroying, or let me say, disrupting the economy, killing more and more people. With this type of infections, they usually have a very high potential to become pandemic. That's the case. This is just a couple of examples. You can have 15, 20 different explanations why it's not a biological weapon.
Albina, what are your views on why this was not a biological attack?
Well, I'm not an expert in biological weapon, but based on the literature analysis, I can say that there are several systems developed to assess whether the attack is man-made, I mean, whether it was an attack or a natural epidemic. And according to the scores which this situation gets when we look through the number of questions, we can say that it's not a biological attack because the virus spreads in a regular, natural way. Virus mutates very fast. It wouldn't be very wisely for people who create biological weapon to use a virus which mutates this fast, and many other aspects like this.
Well, Ken, I have a tough follow-up for you, and it's based on a statement by Gordon Chang, who wrote a chapter to this book. And Gordon wrote that the Chinese government either knew or should have known that the way it handled the coronavirus at the early stages would have infected the world. I'm wondering if you agree with that, and what do you think the Chinese government knew about the seriousness of this infection, let's say in December of last year?
It's interesting. Of course, it's not a scientific discussion. It's mostly, I would say, political. I have, let me say, a Facebook friend, let me say, followers, and just they're asking this question. And for some, a while ago, sometime in February, was the first time I do remember I had an interview on Fox News, And I said, guys, let me say this, the government is responsible, and the government of China is responsible. But I would say even more, maybe even stronger. The government of China should be kept responsible for this pandemic. Because why? Each country has a special system, a system of informing, let me say, the Central Epidemiological Authority of the country about some unknown cases. It's normal for each country in the world. If there is a single case which has no explanation, the information is going immediately to the center and the country should take an action. In this case, just without a long explanation, they knew about something, unusual already in mid-December. They knew that it's unknown, and they knew it was for sure. They knew it was infection coming from somebody. They didn't know details, but it was. But they didn't take any action till January the 9th. And on January 9th, they informed about, let me say, a new virus which is transmissible from human to human. Can you imagine this? I would say 20 or 25 days, for example, of silence. First. Second, after any country, after informing about this, what it does they declare emergency. They organize quarantinization. They put all information about, for example, just everybody who was at certain place, please inform us, collect this information. Then, but instead, as soon as they inform, for example, you can imagine regular people, who came for Chinese New Year, they were, let me say, absolutely scared after that. And what they started doing, they started leaving that place from Wuhan. How many thousands or hundreds of thousands of people left because they, organized quarantinization by January 21st or something like this. Just about 2 or 3 weeks afterwards. Let me say, this is actually two major. One was intentional, and second one, I have no explanation how to say it, stupidity or whatever. Because first, they actually specifically have this information hidden. Just even they knew it's contagious, they knew it's transmissible from people to people. They knew the number of cases were, increasing. They mentioned on January 9th about 50 or so people, but actually all calculations are saying about already no less than 1,000 people. And by the time, for example, they declared quarantinization, actually already tens of thousands of people. This is the case. And these people were everywhere in the world. You can blame the United States, but how could you blame a country which, for example, suddenly finds out, for example, people who left, they were spreading out. In China, it was easier because it was kept within Hubei province. In the United States or Europe, for example, people were everywhere. Each person, it's a new focus of infection. In this case, how you can handle an epidemic having hundreds, if not thousands, of new cases appearing in different places. In this case, at least three things. First, intentional hiding the initial information. First. Second, decreasing the actual number of infected people, and not timely organizing quarantinization and giving a chance for people who were, let me say, in Hunan from January 9th, January 21st to leave the country. In my opinion, at first and second, this again, maybe it's a little bit too harsh. In my opinion, World Health Organization should be kept accountable as well. When they came to China, instead of warning people about the seriousness of the situation, they started praising the government of China. In my opinion, it's not the responsibility of this organization to kind of praising in this situation.
I agree with you on that, and we have we have a chapter in our book on how the World Health Organization mishandled this. Albina, do you have any views of Gordon Chang's view that the Chinese government either knew or should have known they were infecting the world with this virus?
I completely agree with Dr. Alibek that Chinese government, they were hiding the information intentionally, and probably the problem is about the political regimen in the country. And I'm not going to discuss why this happened, why they were hiding the information, but the outcome of such a decision is obvious today. And if all the
No, Albina, it's great you cannot discuss it, but I can say this. It's a typical behavior of a communist country. When I lived in the Soviet Union, I knew everything was secret. Even just a huge epidemic, you would never know, let me say, a number of people and so on and so forth. The only, I think, why it happened, we started getting information because we realized that it's not an epidemic any longer, it's going to be a pandemic. That's why otherwise we would never know about the situation.
I want to ask you now about the lessons that America's enemies learned from the pandemic and the pandemic experience, and how the U.S. and other countries dealt with it. I mean, basically, what lessons did they learn that they could possibly use to stage a future biological attack?
Albina, can you tell? Oh, okay, maybe in this case, let me say again. I don't want to look, let me say, angry, but no, in reality, I'm angry. But I'll try to be calm in this case. Can you imagine this? If a big number of scientists, let me say, have done a very interesting, let me say, very conclusive work saying, okay, guys, it's possible to develop a defense based on new principles. Can you imagine this? I mean, just what we have at this point of time? We have masks and social distance. And just to take a look what we had in 1918, 1920, exactly 100 years ago. Same things. Does it mean that we haven't developed anything for 100 years? No, it's not the case. We know in this case, we have some ways of protecting. And we need to be, in my opinion, we need to move fast, let me say, to go back to the program we had in, let me say, in the government, organized by the government, and start thinking about non-specific defense, because this is the only way how we can save as many as possible lives. Bina?
I would say that this situation revealed that actually United States are absolutely unprepared to any kind of infectious threat, and we see that
unknown threats, yeah, unknown.
Yeah, of course, and we see that in some countries the response was much quicker and much more effective. And the reasons behind this effectiveness is that some non-specific immunity power was taken into account, and the underlying condition which can increase the risk of negative outcomes of such infections was also taken into account. In the United States, it wasn't done, and it's still not considered. So I think that enemies would certainly pay attention to this peculiarity.
And maybe a small addition, if we look through recent publications, there's some information about using interferons for treatment, interferon beta. But that's what we specifically were saying for years, and just published, okay, guys. Prevention, let me say, is the best approach, because it wouldn't cause, let me say, significant damage to the medical system. And it wouldn't, cause so many deaths, because it's scientifically proven by dozens or hundreds of publications and clinical studies, randomized clinical studies, starting in 1982, 1983. And then it's interesting from this point. There's been still been in the Soviet Union. As soon as we found out in 1983, some research has been done in the United States. I gave an order to our scientists, let me say, just to start developing preventative approach to protect against unknown viral threats. And we had these products already in the middle of 80s. And now the entire Russia actually is taking these preventive measures. And if you compare mortality rate per million of people, in Russia it's 5-7 times lower than some other countries. This is the case. Preventing, let me say, at early stages, when we talk about non-specific defense, non-specific immune system, is a very, possible situation. Some people could say, but okay, there was no test, but this system actually is working against any viral infection. That's the case. Why wouldn't we do this? It's, in my opinion, we need to go back, and maybe this book from this point would be helpful to some medical officials just to read and see how it can be done. It's not too late. But this infection is not going to go away.
I want to ask you a related question, and it concerns something very disturbing you wrote in one of your chapters. You noted that terrorists are unlikely to develop biological weapons if there are defenses against these weapons, if there are effective vaccines. But you wrote that it's possible that a terrorist could change the antigen of a pathogen to make existing vaccines ineffective. Now, I'm not a scientist. I thought that was extremely frightening. Could you talk about that? And is that something we should be thinking about concerning vaccines to protect us against the coronavirus?
Probably I can respond to this question. Vaccines are based on the adaptive immunity. So we show our immune system how an infectious threat looks like, for example, virus. And our immune system starts producing antibodies to this specific virus, or more specifically to some antigens presented on the surface of the virus. And when this immunity is developed, yes, we are protected from a natural virus of this kind. However, if we change the structure of this antigen a little bit, then antibodies that we already have in our body, they will not help, because it works like key and lock, according to the key and lock principle. And when this principle can be fulfilled, when this key that we have doesn't work with this new antigen, this vaccine will not be effective. And that's why vaccine will not be helpful when virus mutates, because the structure of antigen will be changed. And also it will not work when a virus is genetically modified to have other structures of antigens.
Actually, what Rabin is saying is it's a great example, actually, influenza cases we have every year. Yes, we always try to find appropriate, we have vaccines from, and we try just to use appropriate vaccine in case of new epidemic. But we know that we're always missing, or practically all the time we're missing, and because the strain would be a little different. But some people say, it's interesting, and there is another point. Some physicians say, okay, guys, in any case, we need to be vaccinated because we are inducing some defense. And this is exactly the case. I mean, that's when we have this type of vaccine, we are not developing specific defense, because vaccines, they have so-called non-specific response to. In this case, they can induce. That's again what we were saying about this. Yes, we knew about some BCG vaccines. We knew about some smallpox vaccination showing non-specific defense. In this case, it's, in my opinion, it's time for scientists, for experts to get together and discuss details, because it's, even for this epidemic, it's not too late, because we are already relying on vaccines. It would be great if vaccine, let me say, is going to work. But at this point, nobody can say this. At the same time, we know about some principles of non-specific defense capable of acting against any virus. In this case, why wouldn't we use it, especially if some clinical studies have been already done?
Well, that's good to know. So you're really saying that a broad-based antiviral is a much better answer to diseases like this. But I want to jump back to the question I asked you a moment ago, because I'm still fascinated and sort of frightened by the idea of terrorists altering these pathogens. And I'm wondering, how difficult is this? And is it realistic that a terrorist group would have the technical expertise to change the pathogen, to change the antigen of a pathogen so it would be ineffective against vaccine stockpiles? I mean, what level of expertise would one have to do that?
You know, if I may, 2003 or 2004, I published an article about possible changes of smallpox, very major, and I told about some research done just to insert some genes of Ebola virus into smallpox. You cannot imagine how scientists started attacking me, saying, "Okay, it's so crazy." But but the problem is in this case, now everybody knows it's not a matter of inserting, RNA, a piece of RNA. It's a DNA copy of RNA. It was shown, let me say, just to increase, because smallpox virus, it's a big virus that just with a huge internal space. You can insert many different genes. And this work has been done. And now research is, but it was 2003, 2004. Now level of sophistication is so high. In this case, just to insert some foreign gene, for example, which would first either suppress a response from first defenders, for example, from NK cells or macrophages. In this case, it's a possibility. In this case, it depends what we put in. For example, we can put some cytokine genes, for example, which would induce a more powerful pro-inflammatory response. Inducing some acute cytokine storm. And just unfortunately, it's already known, pretty well known. I cannot say whether any terrorist organization is doing something like this, but for scientists who understand or work for some governments, it's not a big secret nowadays. Just you can go to literature and you can see what kind of research has been done. Now, molecular biology is already something which is pretty well known to hundreds of thousands of scientists at this point.
And I think the principle of simple clonal selection would also be useful for changing the antigen presented by the viral particle, right?
Yeah, it's a possibility.
And it's much easier. It's like growing viruses, and as soon as viral mutates without any stimulation, like by chance, you get this viral particle, and then you allow it to multiply, and you get the virus with a different antigen.
Again, repeating over and over again.
Yes.
We need to go back to principles on non-specific defense. So many companies have been involved in that program. DARPA has done perfect work at that time. And I have no idea why this program was terminated. Because if it continued, let me say, by now, we knew the ways, for example, how to stop this epidemic at very early stage. In this case, because this is exactly an answer to your question, for example, quickly, guys. If today we have this coronavirus, tomorrow we have, because it's mutating by itself, for example, just we'll have already a few new variants of this. What we remember this is when it was the first SARS, we just having hundreds of isolates. We saw about 15 or so, some distinct, I would say, strains of the same virus. In this case, whether, for example, we are protected, even having vaccines against certain strain, now we do this. Whether we're going to be protected from a new species coming from the same virus. It's already not even a strain, but we say it could mutate such a way that it will be completely, not completely, but significantly different. In this case, it's threat exists, and we need to just based on this work. Of course, we need to be absolutely, I would say, strongly, let me say, just analyzing all situations and start developing a real defense against future threats, especially viral threats.
I want to ask one final question for both of you before we take questions from our audience. Our audience can text us questions through this software, and Adam Savitt will read them to you. It's a simple question. I was wondering, if you were to meet with President Trump in the near future, what would you recommend he do to defend our country against pandemics?
Dina, you start.
First thing, I would recommend to consider some indirect scientific evidence of some measures efficiency without waiting for long clinical trials result, for safety trials results, because sometimes the mechanism of action of a certain drug or a certain compound is pretty well known, and in some individual cases it was shown that this compound would work. And waiting for clinical trials results would cost many hundreds, many thousands lives to us. And I would mention Australia's example. When it was first shown using statistical methods that BCG vaccine can prevent coronavirus infection in some individuals, Australia started vaccinating their medical personnel with this vaccine because it's already known to be safe, and they didn't have any causes to think that that would harm this personnel, and so they just started using this.
Thank you, Ken.
My first suggestion would be to review the actual actions of Food and Drug Administration first, where, for example, they were right and wrong. I mean, continue pressing China to come clean. Third, I mean, to support the idea of what he's doing about World Health Organization. I think it's absolutely a right move. And when we talk about what kind of defense, I think he was not enough persistent in terms of additionally studying hydroxychloroquine and chloroquine. Because analyzing, being a scientist, of course, I've gone through, let me say, publications. Unfortunately, I cannot believe many things, at least some things, for example, published these articles, and especially keeping in mind that some articles claiming that chloroquine was had negative results and were removed, let me say, retracted from some journals. But it's still a matter of discussion. But my personal opinion, it was not appropriate to remove chloroquine or hydroxychloroquine from treatment, because physicians, they have so-called a right for off-label application, and still in some setting, a physician would know, practically would know, for example, what should be done before. And third, in terms of prevention, I mean, in my opinion, because in this case, for example, National Institute of Allergy and Infectious Diseases, I know Dr. Fauci. And you notice that, and if we talk about the institute, why would we go, let me say, to some research done prior to this? Because if you go through, let me say, all publications and research publications from all over the world, if some, I mean, approaches taken by some other countries, analyzing, for example, why for some countries we see a much better result in terms of mortality rate. This is absolutely obvious that something is missing here in the United States. And even just off-label application for prevention of interferons, type 1 interferons, and interferon inducers. This is what the way to go to save many, many lives. In the last publication, May, June 2020, Just take a look, because they say using these interferons on a daily basis for people with high risk medical personnel, it protected 100%. Nobody got infected. When they analyzed, let me say, parallel situation, people who had no this protection, they all were infected.
Okay, Ken, I'm gonna stop you there because I want to give our audience members a chance to ask some questions since we gotta end this at 2 p.m. So I'm going to invite my colleague Adam Savitt to come on screen, and if you have some good questions to offer, Adam, let them roll.
Yes. For the doctor, to the extent you can discuss this, can you tell us what programs or what agents you worked with in the Soviet Union?
Yeah, it's interesting from this point. We synthesized first interferon. I mean, yes, you're talking about biological weapons program, yeah?
Yeah.
Biological weapons program, it's a very old program, actually. Two major ministries were involved. It's Ministry of Defense and our ministry, Ministry of Medical Industry. In addition to this, it was the Ministry of Agriculture, Ministry of Health, several directors. And each ministry was responsible for certain types of biological weapons and biodefense. In this case, but the major developer of biological weapons, it was our main directorate, Biopreparat, responsible for a variety of bacterial and viral biological weapons, and for developing defense against biological weapons, because field studies for interferons we've done, and many things, for example, which are being used now in the Russia for preventions, were studied by us in mid-80s. I mean, after we saw first publications in the United States. And actually, that's why Russia is having a lower number of, one of the reasons, lower number of people who died of this infection.
Do you think free markets help the West combat biological threats, and do you think socialized medicine will make us less able to combat future biological threats?
It's not a matter of, of course, when I'm comparing medical systems, I mean, initially I thought that our medical system here in the United States is absolutely perfect. Here we have a great number of scientists, we have a great number of physicians, but the cost is getting so, high that many people just cannot afford it. But another problem we have, take a look. We talk about some new treatments or prevention for COVID-19. Has anybody analyzed how much this new treatment would cost to us? For example, if one injection would cost thousands of dollars. At the same time, for example, something we have prevention like the same interferons. I mean, the cost like this would be hundreds of thousands times lower. In this case, is it? Of course, I'm not supporting any conspiracy theories. But why, for example, we are promoting something which should cost us unbelievably huge amount of money, at the same time ignoring what we having much lower cost. In this case, I would say from this point, I would say maybe some changes need to be done.
And I have a question based on something you said in your chapter. What if anything has changed, or what additional tools do we have, even looking back 100 years to the 1918 pandemic? I think you kind of suggested there aren't many, but maybe just expound on that for the audience a little bit.
Just again, I mean myself, we read what was happening. Very long analysis of what we saw in the United States. And this, when you read it, same word, social distancing and masks. What we have now, social distancing and masks. It looks like 100 years of research and development in medical fields actually brought nothing to us in terms of protect. Some people could say, okay, we can develop vaccines. But the question is this: yes, we can develop vaccines because we have more sophisticated knowledge. But how much we got up to this point from vaccines against coronavirus? Nothing. In this case, something else needs to be done. That's why what I mentioned again, a DARPA research. Somebody needs to go back. Administration, in my opinion, the administration will go back, analyze, let me say, what has been done by DARPA, what kind of research. Actually, about 20 companies have done perfect studies, and just to select from this. Go back, let me say, just asking somebody who's responsible for this, going back, let me say, and see what has been done for antiviral protection from 1983 and now. And you'd be shocked, let me say, well, how much work has been done and what kind of protection could have been developed preventing people from this infection.
This is a pretty general one.
Alibek and Tskhay, I'd like to thank you so much for participating in this panel. Your chapters were important for our book because you provided a technical scientific analysis. Most of our other authors provided more political analysis, and we were trying to get a coverage of this threat that looked at all angles. And you really added an important part to our analysis, and you did today. Just so our viewers know, our book is known as Defending Against Biothreats. It is for sale right now on Amazon.com. I hope that you'll check it out. This is the second in a series of biosecurity webinars that the center is doing. And this Wednesday, July 29th, we will do a webinar specifically on what terrorists will learn from the 2020 pandemic, featuring Shoshana Bryan and Sam Faddis. Sam is a former CIA Director of Operations officer, and they are going to do a deep dive on all the various ways terrorists could misuse and abuse the lessons of the 2020 pandemic. And some of the things they found are quite frightening. So I hope you can join us for that. Albina and Kent, thank you so much for joining us. For our viewers, thank you for joining us. This panel will be posted on our website, securefreedom.org. I hope you'll join it. And there's a lot of other related material and op-eds. I hope you'll check that out too. So thank you so much and have a great day.